Hello, and welcome to Healthcare Matters, where the medical and legal communities come together to discuss healthcare matters. I'm your host, Mike Matray, and today's guest is Troy Bundy. Mr. Bundy is a hiring partner at Hart Wagner in Portland, Oregon, where he has been defending healthcare professionals since he joined the firm in 1996. Welcome to the show, Troy.
Thanks, good to be here.
One of the major differences is I too have been to a retail health clinic, and it was a nurse practitioner, a physician's assistant, and there was no actual MD or OD on site. And one of the things I noticed would be that what if a more pressing health matter is discovered in the retail clinic? How would they note in the electronic health record or the traditional medical record that they refer the patient to an actual MD or a cardiologist, and how would that stand up in court?
Well, I think in any clinic setting you're going to run into, especially urgent care, you're going to have physician's assistants that provide some of the care, or perhaps nurse practitioners. And the reality is, when it comes down to litigation, PA, though we'd like to just say, well, the PA met the standard of care as it refers to other PAs in the community, that's usually not how it goes. The PA is going to be doing work that a licensed MD will perform, and therefore I think that most juries are going to hold the PA to the higher standard that's required. So routinely I will, in my cases where I'm defending PAs or NPs, my standard experts are going to be internists or family practitioners, whatever the case may be, or emergency room physicians, because I think that is really the standard that's being employed, despite the jury instruction that it's supposed to be the same medical specialty with like training and experience. So, as far as referrals, they need to be well documented in the chart, and that's really all that the referring clinician can do, is make sure that the referral documentation is well set out, both in the order and the progress note, and then most of the time there's going to be a patient take-home of some kind that will have instructions. They usually say something along the lines of, I've recommended that you see a urologist for this problem, or I've recommended that you follow up with your regular primary care provider in regard to your sugars, or whatever the case may be. But I think documentation is always the linchpin of any medical malpractice case, at least.
Well, Troy, I'd like to thank you for coming on Healthcare Matters today. It was wonderful to have you as a guest, and I hope you'll come on again soon.
Thanks.
In your professional experience, do higher limits on a physician's medical malpractice insurance increase the dollar value of settlements in cases of an indefensible claim? In other words, can a physician or entity be overinsured? And conversely, can a case be made that the lower the limit, the lower the risk exposure?